Hello and good evening, I'm Melisa Idris.
And I'm Sharaad Kuttan.
Welcome to Consider This, the show where we want you to consider and then reconsider what you know of the news of the day. Now, some major headlines today are to do with politics. Firstly, we have Dr Anbarasu. He was at Bukit Aman today for questioning following his meeting with the Yang di-Pertuan Agong on Tuesday. Now, it's understood that the PDRM has opened 6 police cases against Anwar since he announced that he had majority support in the Dewan Rakyat. At a press conference later, Anwar said that the police had asked him to reveal the names of the MPs who support him. He declined to, saying that it was between him and the Agong. Also, prominent in the news, we have details of UMNO's demands for its continued support to Berita Nasional. That came out in the open after some initial coyness. Now, UMNO wants a deputy prime minister and some key ministries. So currently, UMNO shares with Bersatu 2 of the 4 senior minister positions. Now, with all these political maneuverings that we've seen happening, are we, the people, just spectators? I mean, I'm really wondering, Sharaad, do we have any agency in what's happening at all?
Melisa, you know, the big question there at the end of your very good setup about what's happening in the country, or at least what's happened today in the country. I do think there are people, of course, who maybe are slightly bewildered, maybe resigned to the fact that a lot of elite bargaining is going on, for which they have no direct input on, and also
but might have direct repercussions, right?
Absolutely, it has completely. I mean, the import of what's happening now has tremendous implications for all of us, especially in terms of what government can do in the current situation of the pandemic as well as the recession. We know that the COVID law has not been passed, right, and that is a consequence, Melisa, clearly of what's happened, or the paralysis in Parliament. There's not been the ability to bring everybody together to support you know, an emergency provision. And I wonder whether, you know, in some sense, the political question has to be answered first before we get to questions of public health and recession.
Yeah, and that's true. I do think it's quite interesting because, you know, in the next couple of days, we're going to see this situation evolve, and I think a lot of people are feeling slightly fatigued, but also, as you said, disconnected. I mean, how do you pay it? You know, we may be interested spectators, but we are essentially spectators. This is all, as mentioned by many political analysts, you know, all political maneuverings at the elite level. This is bargaining power that we have no control over. Yeah,
but surely there are also people who are cheering in the sidelines, who are for this or that individual, whether it's, you know, Anwar Ibrahim, the current Prime Minister, Muhyiddin Yassin, you know, the factions in UMNO who, you know, who have you know, who remain loyal to Najib Razak, to the Zaid Hamidis of UMNO, and also perhaps now a new section of the stands, you know, in support of Tunku Razali. I mean, so you have a whole range of people who are loyal supporters of those actors. But again, there are people who are saying, Melisa, that we should go back to the electorate, to the populace, to get a better sense of where they want the leadership of the country to go and with whom. All right, well, you know, that we're going to keep a close eye on the political developments, but in other news, only 15 media organizations will be allowed to cover parliamentary proceedings on site when Dewan Rakyat convenes from November 2nd to December 23rd. Now, the stated reason for this, according to Parliament administrators, is to curb the spread of COVID-19. So if you look at the list of 15 media organizations, there is not a single media organization on that list that operates exclusively online. Now, and just to note that media coverage allowance for this parliamentary sitting is far more strict compared to the last. I believe the last time there was a cap on the number of, the maximum number of journalists from each organization, but there was no limit on the number of organizations itself. And this is interesting because this sitting is particularly important. We have Budget 2021 tabled on November 6th and a vote will be called on November 23rd. Now, it's also raised a lot of questions, Sharaad, I think, you know, and in reference to our earlier discussion, it's raised the question of balancing COVID-19 SOPs
and democratic freedoms. Where do we find that balance? It's a new normal we have to live with, right?
Well, I don't know if we have to live with this. I mean, clearly these are human-made decisions and with vested interests. And if you look at the lack of consistency around how media covers anything, including, you know, the way the media gathered together in order to cover, you know, Anwar Ibrahim's,
press conference,
audience with the Agong, or any of the other situations that we've had where, you know, press conferences have been called by politicians. So I'm not quite sure why in this instance Parliament didn't bend over backwards to ensure that as many of the media was there as possible. Right. As you rightly put, there seems to be a real deficit when it comes to online media. Many of the online media portals much more substantial in their coverage, much more legitimate in the eyes of the Malaysian public, had greater credibility than many of the traditional newspapers that are on the list, or even some of the other broadcast media.
Right. Well, so some of the questions that have been posed is what is lost by not being there on site to cover? And I think we have to kind of understand the way Malaysian media works. There's a lot of questions that are asked, directly to MPs, especially, and it's not just a matter of reporting what was said, but also pushing back through your questions and getting clarification. That is important to be on site to be able to do that. Yeah,
and also, I mean, I think we have to recognize that, over the last couple of decades, some media, some politicians rather, have tended to taint or frame media organizations as being partisan, and therefore, seek to exclude them from public or events like this, or situations like this. Right. And it's because of a sense that they're not friendly, or they might be hostile, and so on and so forth. And I wonder if that's at play as well. It doesn't seem sufficient to use COVID as a reason for this particular act.
Right. Well, I think what was happening, I think what we need right now is a little bit of clarity, transparency in how these decisions are come by. I mean, what goes into, what criteria goes into the selection of this list. And I think that goes the same as also all the other COVID-19 SOPs. What goes behind the thinking of those ever-changing COVID-19 SOPs? I mean, we heard the National Security Council has reviewed its earlier decision of only 2 diners per table, this for areas under the CMCO. Now they're changing it to a maximum of 4, provided that the table is big enough. Now, how do you determine the table is big enough? Who measures that table? And if the police come and say, well, you're not practicing the proper social distancing SOPs, then can you contest that the table is in fact big enough?
Yeah, and of course we have also the question of cars. Melisa, at the end of this, the SOPs are there, we assume, designed for our safety, and therefore you would get compliance and buy-in if they made sense to people. Right. And then that is, I think, the other issue, coming out hot on the heels of the fact that we had the announcement of the CMCO before the SOPs were even ready, and that lag, again, reminding us that 6 months into this pandemic, we do not have a way of managing these particular strategies in a way that is much more coherent and efficient. Forgivable 6 months ago. Today, the question is, why aren't SOPs being released at the same time as an announcement, so that everybody knows exactly what is happening?
And the thinking behind those SOPs and why they change 24 hours after. All right, let's take a quick break, but after this, we will be discussing the situation in Sabah as the number of COVID-19 cases there continue to soar. Stay tuned to consider this. You're watching Consider This. I'm Melisa Idris. With me is Sharaad Kuttan. Now, experts have warned that Sabah's healthcare system will be at risk of reaching its breaking point in the next few weeks if the number of COVID-19 cases continue to rise at the current rate. Now, today alone, Sabah saw an increase of 498 cases. Over the past couple of days, we've reached out to the Sabah State Government for their report on the situation, but we've yet to secure an interview with them. Nevertheless, to find out what's really happening on the ground, we have joining us on the show tonight from Kota Kinabalu, Dr Anbarasu Ramalingam. He's head for Sabah Chapter of MERCY Malaysia, also the Principal Assistant Director of Medical Planning for Queen Elizabeth Hospital in KK, which is a public general hospital. Now, Dr Anbar, good evening. Thank you so much for joining us tonight. Now, I've read news reports that have described beds full of sick COVID-19 patients, understaffed hospitals, PPE stocks running low, and medical frontliners who have contracted COVID-19 themselves. Dr. Anbar, is this an accurate picture of what's happening on the ground in Sabah?
Okay. Hi, everybody. Good evening. So, as we can see, as far as cases are concerned, they are increasing, on some days reduced for whichever reason it is. But when it comes to hospitals, I think it is an overwhelming situation wherever it is taking place, whether it's in Malaysia or other countries or Sabah or other states per se. Yes, we are being overwhelmed, but I think it is apt to say that we have been holding on. Regarding PPEs, I think during March, during the first wave, I think we have to admit that we were shocked with the outcome or with the demand that has surged, from usual cases to what we had in March. But I think during this time around, however, at this point, I think we are much prepared in terms of PPE is concerned. So yes, the supplies have been adequate, probably running out in some of the places in view of ordering processes or acquiring processes. Otherwise, I think there's adequate, there's enough to make do. Regarding cases or infection among staff, it would be, the bitter truth is that the frontliners are always exposed to all the risks of the healthcare, whether or not it's COVID. So COVID being such a potent virus which tends to spread quite easily, we are always at risk. There have been cases of healthcare workers being infected, but as what DG has repeatedly mentioned, most of these cases has been, transmission of contact from outside, not due to exposure during contact with COVID-19 positive patients per se.
I see.
Okay, Dr. Anbarasu, if we could just look at some of the early kind of outpourings on social media, when the rise began in Sabah, there were calls for people to donate money for, respiratory machines and so on and so forth. And it seemed like Sabah was in a situation where it wasn't getting help from the federal government, or that ordinary people had to give money in order to help the situation. Is that an accurate picture? Was Sabah being neglected, or was social media kind of racing ahead of itself and perhaps it being a little hysterical?
Okay, I think in situations like this, we have the healthcare and whether it's the management or the clinicians, and then on the other hand, we have this curious public or enthusiastic public, if I could say that. So what happens is that in any overwhelming situation, I think we have tendencies to not be able to fulfill everything immediately. The rise of the cases is probably not synchronous with what facilities are available at any point. So Sabah per se is such a big state that I would have to mention that the development, the infrastructure of hospitals, the basics, probably is probably not adequate to provide ICU level care in each of the district hospitals. That has been a reality over the years. But coming to the public side, the Facebook polls and things like that, I think in any situation, whether it's floods or fire or or like an epidemic, pandemic of this this level, I think there'll always be public who are very enthusiastic to help, who will respond to demands of the time to make things faster, the acquirement faster, and they do what.
But Dr. Ambar, was it anticipatable? I mean, in the sense that could you have anticipated this problem, considering we knew that the possibility that the Sabah state election was going to be a real risk to public health in this crisis? Could you have anticipated that happening?
I think the anticipation was very much there, but preparing equipments and I think it will be difficult to predict the exact number or how bad the spikes will be, how much will the turnover will be. But I think preparations have started even way before the elections. The screenings has been done, all the preventive measures have been taken. But despite all that, I think our cases have reached numbers. I would say it's quite staggering. Yeah.
Dr. Ambar, on October 14th, a couple of days ago, the Ministry of Health said that 71% of all beds allocated for COVID-19 patients have been filled, while 57% of ICU beds were occupied. That was a couple of days ago. Now, is that figure, put into context, is that figure worrying for pushing Sabah's healthcare system to stretching it to a limit?
Okay. I think the number of cases have been steadily increasing. There has been the demand has been overwhelming. It is stretching the healthcare, but to say, I mean, we are not paralyzed. We're still functioning. We're still finding ways to figure things out. The healthcare in Sabah, to be particular, is quite resilient. So a lot of wards have been converted. Services have been interrupted, as what it happens in any pandemic situation. The expansion is happening intra-hospitally, I think in every hospital, but the demands of beds have definitely gone up.
Okay, Dr. Ambar, we're going to take a quick break, but we're going to have you stay on the line. We'll come back and continue this conversation, find out about what's happening in Sabah. So we'll be back in just a couple of minutes. Stay tuned to Consider This. Thank you so much for staying with Sharaad and I on Consider This. Let's continue our conversation with the head for the Sabah Chapter of MERCY Malaysia, Dr Anbarasu Ramalingam. Dr. Anbar, the district of Semporna has been dubbed Little Wuhan. It's the worst district in Sabah with over 600 active COVID-19 cases. I'm wondering what's happened there, what's feeding into the numbers in Semporna?
I think the obvious reason we could relate to is what happened around the whole state, which is the elections. The numbers definitely rose to the elections and the contacts that happened during the voting, and possibly a low adherence to prophylactic or preventive measures during and after the elections. That could be the reason.
Okay, Dr. Ambar, what about the other patterns that we see in not just in Malaysia but other parts of the world with regard to the severity of the cases? Seen late presentation of illness, lack of access to medical facilities. Perhaps in Sabah, the question of the many thousands, millions of stateless people. I mean, how is that playing out? At least from what you can tell in the Semporna case.
I think as far as infectious diseases are concerned, everybody has access to healthcare, regardless whether the person is a citizen, registered or non-registered. So the question of accessibility to healthcare is definitely out of the picture. And everyone who is detected positive are done tracing, contact tracing for their family members and friends who have been in contact with, or premises they have been in contact with. So we have tracing via contact. We have people who turn in because of illnesses, because of fever, flu, cough, and so on. Also, we have people who have are being screened via clusters or contact tracing. So I believe if there's one case of indicating that there is this presence of this positive case, let's say in a settlement of non-locals, the screening will be done in that respective areas by the district health officers.
Does the geographical nature of Sabah make it difficult to do all those things, the contact tracing, the testing facilities? Does the geographical nature of Sabah present an obstacle for that?
Yeah, I think in some parts, especially when it comes to the East Coast, I think we do have that issue, those complications, when some are not reachable by phones, some do not have proper addresses, and some there are even some who may not be able to converse correctly or realize the importance of adhering to the SOPs or coming back for their swabs and coming back for their appointments and reviews and things like that. But I believe the district health officers, along with the Sabah Health Department, have been doing their best in overcoming. In fact, the ground staff are well trained for situations like this. So much so some even pick up their slang and making sure they are able to communicate with these people. But to be truthful, yes, the challenges are always there. It is a daily obstacle that has to be overcome.
I want to ask you about the high death rate that's also been mentioned in many media reports. Could you help us understand that? Because it seems to be out of sync with the kind of national picture with regard to death rates. Or correct me if I'm wrong. Is that to do with people's general health?
From the information that we follow, based on what the health DG publishes on daily basis, I would just comment on the 5 deaths that happened in Sabah. I think all the 5 deaths has comorbids, has diseases. It's got accompanying diseases, conditions like stroke and hypertension and things like that. If we take example for the number of deaths that happened, 5 cases recorded in Sabah. From the record, it shows there has been some comorbids to be there, and age also plays a factor as well.
I want to get your thoughts in the couple minutes that we have left about a comment, a call by the Malaysia Medical Association. They had a couple of days ago called for greater decentralization of COVID-19 management to states to address the rising cases. And I think this is especially in the case of in Borneo, where conditions and the problems that they're facing there are, I guess, very different from Peninsula. I'm wondering, Dr. Amba, do you believe that this should be the case? There should be more decentralization? Or, the idea of a one-size-fits-all model based on a Peninsula Malaysia model does not fit?
I think right now centralization works only in the basis that the health ministry gives out the directions and protocols and things like that. There's a lot of customization that happens in the state as well, based on the modality, based on factors or on geographic factors, and based on the population factors and things like that. Decentralization is not exactly good. We exist as a country. But I think the Sabah Health Department per se knows the grounds well and can do accordingly. I do not agree. I agree less, to be precise, for any decentralization of healthcare.
Right. Dr. Anbar, thank you so much for speaking with us. We really appreciate your time and the good work that you're doing there. Thank you.
Thank you.
That's all the time we have for you on this episode of Consider This. I'm Melisa Idris.
And I'm Sharaad Kuttan, signing off for the evening.
Thank you so much for watching. Good night, folks.